Hi, I'm Brad Power, and this is the Cancer Patient Lab. We're honored today to have with us Amanda Grilli. She's representing Complement One, which has a service for lifestyle factors, exercise, nutrition, stress reduction, those sorts of things. And so she'll share both the research that they've done that supports that, as well as the services they provide and recommendations. I know this is a topic that's near and dear to a lot of people in our community, because these are the things that patients can take control of on their own and have some agency in managing their care above and beyond whatever they're getting from their medical team. So just a few housekeeping things before we get started. First of all, this is for information purposes only. This is not medical advice. We try to arm our patients and caregivers with information they can take to their medical team. Secondly, everything here will be made public. So if you're concerned about having your image shared or things you might say or your name, you can disguise your name, hide your image, and don't say anything. And finally, we are a nonprofit 501c3, and we depend on the kindness of donors who help fund the kinds of things that we do, such as host these webinars. And with that, I'll turn it over to Amanda.
Thank you so much, Brett. Thank you for having me. Like Brett said, I'm Amanda. I'm also an oncology physical therapist, a certified lymphedema therapist, and a certified cancer coach. And I've had the wonderful opportunity of being a part of the Complement One team. So I'm super excited to share that with you from more of a therapist clinical standpoint. I will go ahead and share my screen. And if Brad, you can just give me a heads up that you
It's
see
working.
everything. Beautiful, perfect. So, like I said, I'm super excited to talk to you this afternoon, this evening, wherever you are, all about lifestyle interventions and how they can make a real difference in your recovery and long-term health as a cancer patient or survivor. So my goal today is really to empower you with evidence-based information to help you possibly implement strategies that can really improve cancer-related side effects and your quality of life. So we'll kick it off by talking all about exercise. So exercise is, as you can imagine, the area with the strongest evidence for these lifestyle interventions. So much so that there's a huge specialized field known as exercise oncology that I'm sure many of you have heard about before. And so over the past few decades, there has been tons of research in this field, and a lot of evidence is showing that exercise is not only safe for cancer patients and survivors, but it does really help to improve numerous cancer-related side effects, notably cancer-related fatigue, sleep, quality of life, anxiety, depression, body composition, function, bone health, and breast cancer-related lymphedema. When it comes to all of the other side effects, there is moderate to, for some of them, lower evidence, but these are the ones where there's really strong evidence to show that exercise is extremely beneficial. So in 2019, the ACSM published their exercise guidelines for cancer survivors, and this was based off an international multidisciplinary roundtable. And the results are as follows. So when we're looking at the goal of exercise being a reduction in side effects, they're recommending that individuals aim for 90 minutes of moderate intensity aerobic exercise per week, in addition to 2 times a week of resistance training. When we're looking at that survivorship piece, really to help reduce risk of reoccurrence, mortality, and just overall well-being and wellness, we're looking at recommendations saying 150 minutes of moderate intensity aerobic exercise per week, in addition to strength training 2 times per week. So when we look at the next lifestyle intervention, we're talking about nutrition, another really key component in cancer survivorship, as well as during treatments. And so I want to share the clinical guidelines with you. And of course, this is something that's important to speak to your own team to figure out what works best for you. I always recommend that people work with an oncology dietitian or nutritionist. But the one thing I really want to highlight here is the protein intake. So many of us are not getting enough protein within our day. And so the recommendations for oncology patients and survivors is trying to aim for about 1 to 1.2, I'd say is a good place to land, grams of protein per kilogram of body weight. And so you just need to do a little calculation to figure out what that looks like for you. But again, just really, this is a guideline. I really suggest just focusing at working with an oncology dietitian. The other part of a survivorship diet is they highly recommend a plant-forward eating pattern. So really focusing on veggies, legumes, fruits, whole grain, trying to limit red meats, processed meats, sugary drinks, or highly processed foods. Now, the last key pillar in lifestyle interventions is mind-body practices. So these are techniques that help you manage stress, anxiety, mood, while all supporting your overall recovery. And the integrative oncology guidelines suggest that mindfulness-based interventions, whether those are what we call MBSR, so mindfulness-based stress reduction is a program in itself, or meditation, or mindful movement, which can be anything from Tai Chi to anything that's more structured, is strongly recommended. And they show that that really does help to improve anxiety and depression in a lot of cancer patients during and after treatment. The other piece that they also recommend moderately is yoga. It's been shown to have numerous benefits for a variety of populations, specifically the breast cancer community. So those are really those lifestyle pillars and lifestyle interventions that are super important for implementing to really help with cancer-related outcomes. Now, as an oncology physical therapist myself, I could not hesitate but also include cancer rehabilitation into all of this. So cancer rehabilitation, if you're not familiar with it, it's an evidence-based specialized field of physical and occupational therapy. And the goal of cancer rehabilitation is to really help patients and survivors minimize their cancer-related side effects so that they can improve their physical, emotional, social, and functional well-being. So these therapists are highly trained in oncology and they understand the side effects, they understand the treatments, diagnosis to make sure that they're safely and effectively helping people manage side effects. So it's an integral part of cancer survivorship care. There's tons of research within this field, so I just want to include that in as a physical therapist myself. Now, like I said, we've looked at these interventions and we know that exercise, nutrition, these mind-body practices in conjunction with cancer rehabilitation really creates a powerful, comprehensive survivorship plan. And I say survivorship plan, but I wanna just really note that this is for cancer patients as well. This is for anyone, regardless of where they are in their cancer recovery, their journey. So lifestyle interventions have been researched so much, and in fact, they are clinically proven to really improve cancer-related outcomes. Really, what I want to highlight here is there's been a 37% reduction in side effects and cancer mortality, and this is looking at over 30 studies with over 150,000 participants. But what's really interesting to me here is that despite there being so much evidence in this field, there's only been a 5% adoption rate by the cancer community. And we know this from numerous surveys that are out there, from speaking with cancer patients myself as a therapist. We know that patients and survivors are motivated to make those changes, those healthy lifestyle changes, but so many of them don't know where to turn to. They're missing that clear, safe, evidenced guidance that's specific to them. And so this is why I'm very excited to introduce Complement One to you all today. So Complement One was designed to fill this gap, to take vague evidence for exercise, nutrition, mind and body practices, and provide people with personalized actionable support. So it is a platform that you would download on any kind of tablet that you have, a phone or tablet or computer. And essentially it delivers personalized guidance for exercise, nutrition, and breathwork and meditation. So those three pillars that we were talking about to support cancer patients and survivors in improving their health and recovery outcomes. What's incredible and what makes it really different is the program is designed by oncologists, exercise oncology specialists, and nutritional experts. And it's all built on the latest clinical evidence. And as you will see, it's also developed in partnership with AICR. So let's take a closer look at what this platform is so that you have a better idea. So as I mentioned, it is a platform. And so once you go into the platform, the first thing you would do is fill out a simple intake form. From that simple intake form, the app has a really sophisticated rule engine. And what that does is that it will create a program individualized to you, to your cancer type, to your treatment history, to where you are in your treatment history, to your side effects that you're experiencing, and any other health conditions. From that, it'll generate a program that's specific for you. And so each session lasts 45 minutes, and we recommend that people do 5 sessions per week, and I'll explain why. So each session has 3 components, as I mentioned. There's personalized exercise, which lasts 30 minutes. And so this is why we're recommending 5 days a week to build up to that 115 minutes of aerobic exercise per week that the American College of Sports Medicine recommends. It also includes in that session 3 to 5 minutes of focused nutritional guidance, in addition to about 7 minutes of breath work and meditation. Now, what really drew me to this app as a physical therapist myself is how individualized it is. So one of the biggest concerns that I always have is I want to make sure that patients and survivors are safe. That is the number one thing, is that when they're implementing any sort of exercise, nutrition, or breath work, they are safe. And the only way that we can ensure that exercise and all of those things are safe for the community is if it's individualized. And so in addition to having that rule engine that's individualizing the exercises, what also makes this really different is that you also have a live exercise coach who is joining each session with you. And so that live exercise coach is adding that human connection, is adding that piece to make sure that while you're doing those exercises, it's further modified and adapted to you. So depending on what you're experiencing that day in terms of side effects, or if you've started chemotherapy or ended chemotherapy, that coach will be there to modify it depending on where you are that day. They meet you where you are. So we get this question a lot, who are these coaches? And so these coaches are specially trained in exercise oncology, oncology nutrition, and trauma-informed care. And they go through really a rigorous training and numerous certifications to ensure that the guidance that they are providing is safe, as I mentioned before, is evidence-based, and is personalized. That is the most important part. So that gives you a good idea of what this platform does. And I'm really excited to share some of our engagement and the impact that Complement One has been having. So the clinical trials are demonstrating really great participation. We see here that 90% of members are completing 5 sessions per week, compared to only 5% nationally. We also see that this is translating into really meaningful outcomes for our members. So we're seeing a 37% reduction in side effects, 18% reduction in pain, 27% improvement in sleep, and a 16-point improvement in overall quality of life, which we measure using a standardized questionnaire. So all of this is just really exciting, especially as a therapist who has worked in this field for over 10 years now, just having something that'll help people to make these meaningful changes. So to wrap up, as I mentioned, we are very excited to share this information with you, and we'd like to offer you a free 1-week trial of Complement One. All you need to do is just send us an email using that subject line. but I hope that helps to provide a little bit more background on these lifestyle interventions to improve recovery and long-term health. Thank you. I'll hand it over to you, Brad, for any questions.
Thanks. As usual, we'll use the raise hand feature and or the chat for people to submit questions. Just want to get us started. I'm doing the math a little bit. I'm a math major. And you said
Me too.
five sessions of 45 minutes, and I just did multiply that's 225 minutes. And yet you said 90 to 150 minutes was the amount of exercise people should get in a week. And I recall from our session last week with Katie Schmitz that if you exceed, that's actually a bad thing. She said it's a upside down U. So too much exercise, and Roger raised the example of the marathon runners who are then increasing their risk of colorectal cancer.
Mm.
So you don't want to have too much. So how does the 5 sessions at 45 minutes stack up against the 90 to 150 minutes you're supposed to get in a week?
Yeah, so that's a great question. So the session itself is 45 minutes, but the exercise component is 30. And so that's where we're doing 30 times 5 is bringing us to that 150 minutes. The
Okay.
nutritional piece is just guidance. It's really just focused on guidance, and then you just have some breath work and meditation. But I totally appreciate that you brought up the fact that too much exercise actually can have negative side effects, and we see that often with that kind of it's a upside down J curve where you're kind of passing 300 minutes where then exercise is can actually be detrimental to you. So that's why we're recommending those 5 times a week.
Okay, so one of those 45-minute sessions actually touches on all three of the
Yeah,
mm,
exactly.
lifestyle interventions you've been talking about. And
Exactly.
just curious, is that one-on-one or in the picture you have on the screen now, it looks like it's one human coach and then maybe 4 or 5 people?
Yeah, so the platform actually started off with one-on-one. And we quickly, after doing numerous service with our members, we quickly realized that they actually wanted joint sessions, which was really interesting to us. And so now our sessions are actually 1 to 6. And it's been working super well over the last few months. The coach is still able to modify. And the people who get grouped together are grouped together within a specific rule engine so that they're experiencing similar side effects to make
Uh-huh.
it easier for the coach to modify and supervise them all.
Yeah, we had something similar. Carrie Winters Stone at OHSU was on an earlier session we had, and it was during the pandemic, so they went virtual, they went online, and they were surprised to find that people had community. And it was actually an unexpected side effect was they developed a community such that the group kind of wanted to keep in
Mhm.
touch with everyone else in the group doing the exercise. So there's a social element to these group exercise for many people.
Totally. And that is something that we unexpectedly also noticed is people want community. And that also is a drive, a motivation for a lot of people to stick with coming back so often is that it really minimizes that isolation that a lot of people experience.
Now, how are you able to schedule this? I think one of the biggest challenges for anything, for myself, for anybody, is how do I find time in my busy day to go dedicate the time that I know I should? It's like the things I know I should do, but I don't often do what I know I should do. What are some of the tricks? I guess if you have a scheduled meeting like that, that's one trick. Anything else you found that encourages adherence to whatever people know they should be doing?
Yeah, the biggest thing that we noticed in terms of adherence, so the number one, as you mentioned, is you're scheduling this time for your live session. And so now you have this person, this coach, this exercise coach who is waiting for you to show up. But the other thing that we've noticed drives adherence is the community piece, which is so interesting to us, is people are searching for community. And that was something that was surprising to us that really is driving that adherence more so than the fact that they know that this is important and beneficial, but it's really the community.
As you look across the three forms of lifestyle intervention, can you say anything about um, sometimes people don't have time. We had, again, in the session we had last week, I think it was Matt DeAngelis was saying, I'm undergoing chemotherapy. I'm tired. I'm trying, maybe people are still at work. They're still trying to do work. And if they had to, I don't know, focus on any one of the three, or would you say, well, only do 15 minutes, but do all three, or focus on one or the other? How would you think about kind of flexing the combinations of things that people might do if they can't do what's ideal?
Yeah, it's such a great question. So exercise is just backed by so much research, and we know that exercise to be very beneficial. And what I mean by exercise is that can be structured exercise where you're following an exercise program in a platform like this, or it can just be day-to-day movement, walking. And if it's a day where we're more limited in our mobility, just doing simple movements in a seated position is very beneficial for combating a lot of these cancer-related side effects. So I think if someone is looking for being overwhelmed from a time standpoint, I think focusing on exercise is a great place to start. And like I said, it can just be a few minutes. Any movement is better than nothing. What is something that a physical therapist likes to say quite often.
Yeah, Katie Schmidt's made that point as well. Just the biggest value she said was people who had been sedentary doing something.
Yeah.
That's the biggest payoff. And then, everything else is good, but that was the biggest payoff. Okay, we have a couple of questions in the chat. Roger asks, what adverse effects have you observed from too much exercise?
Yeah, so a lot of the times what ends up happening when we do too much exercise, it actually affects our immunity. And so that is the biggest thing that I've noticed amongst the cancer community, but amongst the general population as well. So I remember that research study about that kind of upside down J, where if you're doing too much exercise, what happens is that it ends up being a negative effect. And most of it is focusing on decreasing your immunity primarily. And so that could mean very different things for different people, but that's the biggest side effect that I've seen.
So it could just mean they get sick, they get colds, they don't have a resilient defense against things that might be affecting them.
Yeah, exactly. And the biggest thing with exercise is that we need to give our body enough time to recover, right? And so if we're pushing our body to its limits at all times, we're not getting that recovery piece, which is also very important for being able to then do more the next day. So that's definitely from that standpoint.
And that then triggers a question about measurement. We'll come to Alan Morris's question in a moment, but just in terms of, I know that I have an Oura ring, and it
Mhm.
tells me you had a good day of activity yesterday or not, or too much, or rest today, your heart. So are there any medical devices that you recommend that can complement people measuring any of these metrics, too much exercise or anything else?
Yeah, so I have an Apple Watch, and I personally like the Apple Watch because it does track a lot of steps. It tracks my movement. I always like to see my little rings closed. An Oura ring is great. I know that it's been more developed for sleep, which is also an important consideration for a lot of people when we're focusing on improving, especially cancer-related fatigue. We know that exercise is one of the best ways of improving cancer-related fatigue, but we know that we need to balance that with rest and recovery. So the Oura Ring is great for that. Fitbits are also really awesome for just being able to track exercise over time. My husband has a Whoop. He really likes it. It has tons of data in there. But I think it's just about finding kind of what works best for you. I have patients who actually just have pedometers attached to their belts that are going back in the old-fashioned ways, and those honestly work super well also.
Thank you. Hillary asks, how do we measure? Oh, no, that's Alan. I'm sorry. Hillary asked about dance parties. Do you offer exercise dance party sessions?
We so do so in complement one actually we do have dance-related exercises, which have been incredibly fun. And a lot of people seem to love them. And again, the coach is there to modify them.
Very cool. Any besides dance parties, any other variations?
Yeah, so the majority of it is really structured, kind of as you saw on the screen here. I'll just go back to that slide. The majority of it is very structured kind of exercises. We use very, very minimal equipment because we want to make sure that this is accessible to everyone. But like I said, we do have those dances. We do have a yoga instructor who also does some yoga exercises geared to everyone. Some of it is floor chair yoga, and some of it is traditional standing yoga. I'd say those are the varieties that we have.
Okay. Picking up on the comment about over-exercising and the immune system, Alan Morris, who's a pathologist, citizen, sort of a doctor scientist.
Mhm.
How do you measure immunity status in the study you alluded to?
So in that study, I can't recall off the top of my head. That would have to be something that I look at. It's a while, but I'm happy to share that resource with you, Brad, so that you can share it with the community.
Cool. Helen asks, if you're doing intermittent fasting and not eating until noon, for example, but working and doing Zumba at 10 a.m., is there anything wrong with that?
So that's a really specific question, and that's definitely something to speak to your healthcare team about. And like I mentioned before, I really highlight working with an oncology nutritionist or dietitian because they'll be able to figure out if that is safe for you and most appropriate for you, depending on where you are in your recovery.
I'm just going to ask a question that's one of my pet peeves. When I was diagnosed with lymphoma, was getting a chemotherapy cocktail,
Mhm.
I spoke with a nutritionist at Dana-Farber, actually at Brigham and Women's, and said, like, what should I be doing that's unique to me? Because I've got lymphoma and I'm getting chemo. And what they gave me was a guide, which was basically what you said. Eat plant-based, don't eat red meat, avoid sugar. It was generic stuff that I already knew. I've been, tracking what's healthy in general all the time, but they didn't personalize it to
Mm.
my situation, which I thought there must be something. I would think that, with chemotherapy, with lymphoma, it must be different than with somebody with a different cancer and with a different treatment. Any
Mhm.
thoughts to you or any comments you could make about personalizing at that level?
I mean, I definitely think that across all cancer care, we should be personalizing our care. That's what ensures that it's really safe and appropriate for that person. Like I mentioned, especially as a physical therapist myself, really focusing on personalizing exercise is so important because we don't know where people are in terms of level of functioning, mobility, deconditioning. But I really think that that should be the case across kind of all of the interventions, specifically nutrition. You have some people who are experiencing severe muscle wasting because of their treatments, and they definitely need different nutritional recommendations compared to someone else who's in survivorship. So 100% agree. Standard cancer care needs to be much more personalized than it currently is. Um, that is what I'm hoping for the future, and I've been trying to work hard to make sure that we are developing more personalized standards for patients, but absolutely.
Thank you.
And this is
Um,
Katrin. I can just, if I can
yeah.
chime in for a quick minute. What we do is in complement one, and it's our name, it's our identity. We're complementary to standard of care treatment. So another aspect of the personalization could come and oftentimes comes from your medical team who can see if you choose to share um, the program with them, they can get reports and they can see, did you input your information correctly? How are you progressing? And they can kind of work jointly and further add to personalization of your program, making sure that it's safe. So very important point. Just wanted to make sure that everybody, got a preview of this. Your medical team, your oncologist could get access to complement one, and they often do, and then they see reports and you know, they work with us to make sure that it's further personalized and safe.
Thank you.
Thank you. Brick Davis has a question about cost. How inclusive is your program? The pics show only women and only one was of color. What about people who will not be able to afford?
Yeah, so such a great question. So our program is absolutely inclusive. So we have oncology. All of our co-active coaches or exercise coaches are across the U.S. from all different regions, all different backgrounds. So definitely inclusive. We do have quite a bit mix of female as well as male. And then the cost of the program is $20 per session. Yeah.
Okay, so this free week that you're got the slide here is a sample of a test, and then if people want to stay on, then it's $20 per. Did you say per session?
Per session, exactly. And if you reach out to our team, they'll be able to provide you with so much more information about cost and all of those things as well. But this is five individual live sessions.
So again, I'm just going to be the math major since I started there and do the math. So if we had 5 sessions a week at 20 per, that's $100 per week. Over the course of a year, it might be $5,000.
Mm-hmm.
Does insurance ever cover that?
So that is something that we are working very hard on trying to implement, because we know that a lot of cancer patients, survivors do experience financial toxicity. And so we are trying to really figure out ways of making this much more accessible. And so a number of ways that we are doing that is we are trying to work with insurance to see if they are willing to cover this. We have also approached numerous different cancer facilities to see if they want to onboard this as something that they're offering their survivorship through their cancer survivorship programs. So there's a few different ways that we're trying to make it much more accessible to the community.
Thank you. David Plunkett says, I guess when we were talking about Fitbits and Whoops and things, he likes his Samsung watch. So just put in a plug there.
Amazing.
And then Hillary says, Dr. William Lee offers a course on nutrition with emphasis on anti-cancer diet, foods for apoptosis, immunity, angiogenesis, etc. Are you acquainted with that nutritional advice from Dr. Lee?
Pardon, I just missed the last part of your
Are you
question.
acquainted with that with Dr. Lee and his recommendations?
No, I'm not too acquainted with it. Like I said, I focus as a physical therapist. I'm much more focused on that part of the exercise oncology. When it comes to nutrition, I always refer out to my dietitian and nutritionist colleagues. So I'm not familiar with that.
Okay. And again, we made the connection that you're in Paris and Helen is in Paris. Are you practicing in Paris as well? We could generalize this. Are your sessions, which are virtual, which presumably could therefore be global, is your scope US or ex-US?
No, so myself as a therapist.
No, just the complement one as a service. Is it primarily US focused or is it global?
So Complement One is primarily US focused. However, we do have members from all over the world.
Yeah, okay. I think David is confirming the right website, but it's complement1.com, David. So I think that looking at this email address, this should be the right site. Rick Davis says compliance is huge. At that cost, it's a barrier to compliance. Do you have any comments on that?
So is the cost a barrier to compliance is what they're asking?
Yes.
So at the moment, we haven't seen that being a cost being a barrier, actually. I think the biggest barrier that we've identified, and Katia, you can correct me if I'm wrong, I think is more just people implementing it in terms of time-wise. And Katia can definitely comment on that. But I don't think that cost has been the biggest barrier that we've identified.
Yeah, so the total cost per month, as you mentioned, right, adds up to right about $400 per month. We are a young company, so as Amanda mentioned, we are working, and our mission is to make it accessible to as many cancer patients and survivors as possible globally. We are raising awareness around the impact of lifestyle. We have invested right heavily in our clinical trial to show that that could drive meaningful results. But however, we are a company, we're starting, so we are starting with a $400 subscription for those who can cover it right now. We are working with some cancer centers that strongly believe in programs. Some of them are top 5 NCI designated cancer centers in the country that have opted in sponsoring this program or supporting part of cost of this program for their patients. So the oncologist would refer their patients to complement one, and they would kind of supplement part of a cost. And then, of course, again, long term, we're looking to work with insurance companies that would be reimbursing this. But as a code right now across the country, it is not reimbursable. And I feel like it is an issue. It's not necessarily complement one issue, it's a broader access issue that we're looking to address. But it, of course, will take some time.
Maybe this is a question for Katja. I just wanted to build on that. You mentioned your relationship with AICR, and we had Nigel Brockton on. I presume you know him. And you mentioned you have some major cancer centers that you work with. Any other collaborations you have? Any partnerships?
We are in the process right now of launching with some cancer centers and health systems. From a legal standpoint, of course, it takes a lot of work and permissions too, especially when it comes to cancer, to be able to share it publicly. So at this time, I could say that we work with a top 5 NCI designated cancer center in the US. That's what I'm allowed to say, but we're really excited to be able to share more news as we develop this partnership further in the near future.
Okay. Vic asks, and I guess this is getting at the cost question, can you have less than 5 sessions per week to save on cost?
Yes, absolutely. And so if you reach out to the support team, that's something that they can absolutely discuss with you. We're like we mentioned, we're trying to make it as accessible as possible. So it's not an all in or nothing kind of situation.
Yeah, so I guess that answers Rick's question. So this does not necessarily require a $400 outlay per month.
Exactly.
Okay. Any other questions? So just a typical question, Amanda, that I like to ask to kind of as we wrap things up is for you to leave any words of wisdom, summary thoughts, major key messages you'd like to leave with us.
Yeah, I think probably something just to bring a little bit more light to something that we mentioned before. And when it comes to implementing these interventions that we talked about, and you're looking at those numbers of 90 minutes per week or 150 minutes per week, like I said before, any movement is better than nothing. So even if it means a day where you're more sedentary and you're sitting, even just doing any little movement in sitting is wonderful. And it's just about building upon that to maybe reach those goals one day, but anything is really beneficial.